Okay, perfect. Okay, we are ready to rock and roll. Hi, everybody. Thanks for joining us. Welcome to Menopause Chicks and the truth about perimenopause and menopause. My guest tonight is Dr. Rochelle Harder, who is a doctor of naturopathic medicine in Vancouver. Hi, Rochelle.
Hello.
Thanks for joining us.
Absolutely. I'm so excited to be here.
Okay, cool. I just want to make sure I need you to say something like really smart and savvy right now so I can see your face.
Okay. Well, I want to say first and foremost, I'm super excited to be in this space to chat with everyone, and that fact that everyone's setting aside a little bit of time tonight to learn a bit about menopause and the changes within. So this is really great.
Well, thank you for taking the time. I'm not sure how many guests we have with us tonight who were originally supposed to be in Vancouver with us a couple of weeks ago. We did have a little bit of a snowstorm in Vancouver, and so we've postponed to tonight and we've taken it online. So thank you for joining us. Let's get started. I know we've got a number of people who have already said hello. Hi, everybody. I see some girlfriends from Ontario joining us. That's amazing. And some members from the Menopause Chicks community. Rochelle, I think it's really important if we can just kick this off, because the title is The Truth About Perimenopause and Menopause. And that means there must be some untruths. So can you give us your definitions of perimenopause, menopause, and postmenopause?
Absolutely. So as we were discussing earlier, it's really important to have proper definitions around these, because it will change about how your doctor is going to treat you or address your concerns. So perimenopause is the state in and around your before your last period. So this may begin around age 35, continuing up to age 51 or so, which is the average time for women to experience menopause. Now, menopause is the 1 year anniversary from your last period. So it's really just one singular date. And from that point on, that consists of postmenopause. So the hormone changes are different. Perimenopause, we see fluctuating changes of estrogen and progesterone. This is where the symptoms can vary a lot, with heavy bleeding, mood changes. And then menopause, again, it's just that signifying date. But post-menopause is when we see the lower lying estrogen levels and more insomnia, potentially hot flashes, persisting symptoms.
Right on. And what about ages? Let's throw some ages around this.
So the perimenopause can begin from anywhere from age 35 to 51. The most common time frame of having the year anniversary of your menopause is 51 or 51.2, I think, around that time frame. So those are the usual general rules.
Right. So for anyone who doesn't know, the average age is 51. I reached menopause at 49. And there's so much fluctuation happening in that phase of life leading up that, women can get confused because they might not have a period for 8 months and they assume that's menopause, and then they get it again. So very, very common experience of perimenopause. And thank you for clarifying the definitions, but we missed an important step, Dr. Harder, and I think it's because I was trying to figure out the technology. Why are you so passionate about this subject?
I'm so passionate because I think women, for our whole lives, really, we kind of are holding up the world and often giving out and offering and holding up our families, our careers, our relationships, really just offering our energy outwards. And when it comes to menopause, it's a time where you get to reflect in and actually see, how can we build you up and how can we actually focus for you for once. And it's really just a beautiful time. So I love being part of that experience, and kind of just dismissing some of those myths out there and empowering women to see that there's a lot of fun to be had in this next phase of life, and it's not all doom and gloom.
Oh, you and I are going to be fast friends. I love that.
Yeah.
And many women I find in the Menopause Chicks community are quite curious about what it would be like to have a naturopath on their health team. So can you please describe for us, what's it like to work with a doctor of naturopathic medicine?
Sure. Yeah, I'm happy to answer this question. So, if you've not seen a naturopathic doctor before, you can expect a really comprehensive approach to your concern. So, when a patient comes to see me, especially if it's related around hormones, I like to set aside a good chunk of time, usually around an hour. So, this is where I create a space and I just sit back and I want to hear your story. So, tell me about your periods before menopause and then time around that. And we really want to paint that picture. In addition, I want to know how your stress levels are. What are your biggest stressors? What do you do to manage those? How is your digestion? It all plays in, as well as how is your sleep? How is your sex life? How do these factors really play into and shift our treatment plan that we're going to kind of gear and make just for you? So it's a quite in-depth process, and again, it's really kind of a cooperative team approach, and it's always different for each of my patients. I find sometimes someone comes in having researched everything. They're like, yes, I want to do hormones. And we discuss that. Or some people discuss using maybe nutraceuticals, vitamins, and minerals. And we take that approach. So it's really individualized. And you can kind of expect in-depth testing and assessment to really get an idea of what is going on.
I'm going to go right back to the very first thing that you mentioned, which is time.
Mhm.
That is something that a lot of women will comment on. You know, went to my first naturopath appointment and we actually sat for 60 minutes and talked about me. And so definitely that's one of the benefits. And then the next thing that I want to hone in on is you mentioned stress first. So what is the role of stress and what's the messaging that we want women to understand about stress management as they are navigating this phase of life?
So, stress is paramount, and the way stress affects your transition into menopause and this new phase of life is very important because a little bit of the physiology, when your body is stressed, you are relying on your adrenal glands, which are these particular glands that sit on top of your kidneys and they produce adrenaline and cortisol. That's their main job through life. But when you enter the menopausal phase of life, a new job is tacked onto them, and that is producing now your female hormones.
Mm.
So, if you've lived a very busy, stressful life where you've had deadlines and you've come last in all of those scenarios, tacking on that extra job to those adrenals, you're likely going to struggle through that process. So, managing stress, taking breaks, prioritizing sleep, looking ways to either do yoga or meditation, bringing down that stress level will really just allow those adrenal glands to take over more efficiently and just create that ride a lot more smoothly rather than big bumps through the road.
Yeah, that's great messaging. I don't even know if you can answer this question, but why is the conversation about adrenal health so uncommon?
Yeah, it's a good question in itself. And I ask myself that all the time. I think it's because in the conventional medical world that when it comes to the adrenal glands, the realm of knowledge usually exists under are they functioning or are they not at all? So it's
Okay.
kind of two opposite ends of the spectrum. Now, what we look at as naturopaths is what is optimal for you to function well. And I think that's where our medicine shines, because while you may still have normal-ish hormones when it comes to your stress hormones, it's all about how your body's adapting to that, and that's recognized differently in our world. So
Right.
if that answers your question a little bit.
Yeah. So it's a bit of a sliding scale then. Our adrenal health is a sliding scale.
Yeah, it is. Mhm.
And how would someone know perhaps that would be something that it's time to pay attention to?
So I always like to do a bit of an inventory to see just triggers for stress. So when you're stressed, how do you adapt? Do you feel like you kind of run off the handle and your stress levels come up to here, or you're ruminating and you can't go to sleep at night because you're thinking on and on and on? Does it feel like you've just lost control? Or are you waking up in the morning just depleted? Does it feel like you're running on empty all day? Does everything feel difficult? Does it feel like everything's just a chore?
Mm.
Or are you getting sick often? That's a bit of a sign that maybe your adrenal glands are a little underperforming. Those are the signs, but we can also do some objective testing as well. So there are different hormone panels that will assess your cortisol and stress hormones, so we can kind of see a bit more objectively as well.
Hmm. I'm going to jump in because I just saw this question in the queue, and one of our members wants to know, is it the same as feeling tired yet wired?
Yes, that's exactly it. Yeah,
Okay.
there are effectively different phases of adrenal fatigue, as the common term is considered. And initially, you kind of have the adaptive phase, where this is where I see some women early on. They're dealing with all these stressors, but they're dealing with it okay. You know, they can go to sleep at night, but their days are really full.
Mhm.
The next phase is a little bit of that wired but tired phase. So you feel tired, but at the same time, it's hard to go to sleep at night. Your mind is on kind of overdrive. Then the last phase is going to be that kind of full burnout where everything is difficult. You're dragging your butt through the day. So,
Right.
yeah, there's a bit of a spectrum there too.
Cool. Thank you. And then the next thing that you mentioned was sleep. So let's talk about the importance of sleep, particularly in perimenopause.
Oh, yes. So sleep is probably the most underrated treatment that you can do for yourself. We all need it, but because we all do it, we kind of undermine it. So it's when we are sleeping that our body gets to detox any hormones, any toxins from the environment, but also where we produce our hormones. We finally get to
Mm.
go offline, and our body gets to recharge and replenish, and we restore our body. In addition, it's the production of melatonin, which we all know is that sleep hormone, actually encourages progesterone production and progesterone receptor activity. So we know that we need lots of that progesterone in menopause. That's that balancing hormone. So it all ties in. Um, and again, just making sure you're waking up with some vitality. That's going to be the best part in itself.
Okay, you mentioned progesterone, so I think that's a great segue. If we could now get you to define for us maybe the top three female sex hormones: estrogen, progesterone, and testosterone,
Mhm.
and unpack those for us.
Sure, sure. So when it comes to estrogen, let's start with that one. That's the one most of us are really familiar with it. That's more of the feminine, kind of vivacious, feeling kind of alive and really good. And that one also keeps kind of our thoughts on path, our
Mm.
head clear and focused. It also is really important for our libido as well as for vaginal lubrication. So that one is important there. It also largely regulates our periods too, and how much we are going to be bleeding each month.
Okay.
In addition, progesterone. Now, these are always in a bit of a flux. They're ideal when they're balanced because progesterone balances that estrogen. So it calms your body, it allows you to relax. It manages also your weight. It manages the heavy periods that you're having. And that one in particular is important for anxiety and sleep itself. Then, when we think about testosterone, testosterone is important. We tend to think of it as a masculine hormone, and it generally is, but women need it too. It's in charge of also libido, confidence, feeling kind of in charge and alive in itself. We have lower amounts in our body, but we still do require it as well.
Okay.
Mhm.
And any other hormones that you want to include in that list?
Yes, so cortisol. So
Yes.
that's the main hormone coming from your adrenal glands that we've already addressed pretty thoroughly. But that one is also going to largely affect your energy levels, how your body adapts to stress, and again, how your body is going to be producing the rest of those hormones that we talked about.
Yes.
And in addition, your thyroid. So
Yes.
those are a bit of the constellation. I kind of consider it as a triangle, those
Okay.
three. So you have your hormones on the side, the testosterone, estrogen, and progesterone. The baseline is your cortisol here. And then the other side here is your thyroid. So they all rely on each other to be functioning well. A lot of symptoms of an underactive thyroid can look like estrogen symptoms with
Yes.
heavy periods and brain fog and weight gain. So looking at all of those is really important as well.
Yeah. And I think you've just nailed, one of the other sort of truths of perimenopause and menopause, and why this learning about the subject can be somewhat confusing for women is because many of the experiences associated with thyroid will mimic, as you mentioned. So why is it so confusing? And is there any way that we can kind of clear a path for women so that they can get as informed as they possibly can?
Hmm. Absolutely. It is a complex world. And most definitely, when I was learning about this too, I was having to get my head wrapped around it in many different ways because they're all interrelated. So, some symptoms of this can appear as symptoms of these different hormone dysregulations. So, yes, it's important to address them both. So we can kind of either test with objective blood tests for thyroid as well as female hormones to see objectively, but also for women to educate themselves. So there are some wonderful resources out there, some books like Mokita that you've written that is absolutely wonderful. And I find a very concise and direct idea that lays down the intricacies, as well as some other books that I like too that I find are really accessible.
Yeah, name them.
Name them. Well, I have one
Sure,
right
if you want
here
to.
if
Okay,
you'd
good.
like. So there's this one here. So the Hormone Cure
Yes,
by Sarah Gottfried. As you see,
loved
I
it.
tabbed it. Ugh, it is so comprehensive and I
Yeah,
find very
I
accessible.
use it every day.
Yeah, yeah. It gives you tools and tips and assessment tools as well as actual treatments that you can kind of take forward. So
Yeah.
I would recommend get comfortable with the terminology, read these things, make notes when you go to talk with your hormone literate healthcare professional, whether it's a naturopathic doctor or your medical doctor. You have questions there and you can have a dialogue and things can be cleared up much more easily.
Oh my God, I love the term hormone literate. Thank you for that. I'm stealing it. So the other really confusing conversation for women, not always, I guess, when they go to see their naturopath, I find, but it's confusing in traditional medicine when women are trying to navigate what their options are. One of the options is hormone therapy. So what is that? Why is it confusing? What are some of the benefits? And let's just hear your thoughts and expertise.
Sure. Okay. I will do my best to keep on track because, of course, this is a
It's
very
a
intriguing
big
topic.
bucket.
It
It's
is.
a
So,
big topic.
so
Yeah.
feel free to jump in there if I'm going wayward. So by our hormone therapy, there's different types. So basically, in the general nutshell, it's using hormones to balance your own hormones. So
Yeah.
these are generally done through either oral or topical, rubbed through the skin, or as well vaginal. And again, the goal is to optimize your symptoms or your experiences of menopause and really see, can we improve that? Now, as I kind of touched on there are different versions. There are synthetic hormones that essentially are derived in a lab, and they are different from your own. So they're going to have a different response in your body. Your body's going to react in a different manner. Then there are bioidentical hormones. Now, these are also derived in a lab, but they're derived from natural sources such as yam or soy. Now, these in the word are identical to your own. So when it comes to side effect profiles, they're drastically reduced, if not negated or safer in itself. So it's important to know the difference there. And there's a bunch of different names and terminology. So that's where it can get confusing. So again, finding your hormone literate doctor that you feel comfortable making sure that they understand the difference is very important. Um, Obviously, the pros of I generally prefer and I fully use the bioidentical hormones
Yes.
because, again, they're safer. They are gentler doses. Generally, the optimal idea is the lowest dose for the kind of the shortest or the most effective time frame that optimizes other results. And then before even considering using hormones, I always like to assess your eligibility. So we kind of talk about, do you have any family history of any hormonal conditions like breast cancer or endometrial cancer, uterine cancer, or strokes or clotting disorders, on and on and on. Really getting an idea, because if you personally also have those risk factors, then these hormone therapies may not be your best approach, which would mean that we would consider using hormones or vitamins and minerals, which can be very effective by themselves. So that's just a point of caution for us too. They're a potent being or potent things, so we have to be mindful. And then obviously the concern around some of the cancers, as I talked about too. So previously, where there's a lot of confusion is around a Women's Health Initiative study that was done and completed in the early 2000s. And that study basically showed that, yes, there was a bit of an increased risk of the hormone cancers, as I mentioned. Now, it's important to know that that's an increased risk. It's not to say that every woman who took these got these cancers. So that's important there. Also important to know that this study used the synthetic hormones. So different than the hormones we're using today and a different approach. As well, it's important to consider your time frame. So if you're age 60 and under, if you're from 10 years of menopause, that's an ideal time frame and very safe to use hormones. If you're on the outer skirts of that or you're beyond that, it doesn't mean that you are kind of nixed from using any of those therapies. It just means that we might assess your risk in a different fashion. And I like to use risk assessment tools looking at breast cancer risk as well as cardiovascular risk to see
Mhm.
if you personally have any of those factors that would dissuade us from using them. So that's kind of my approach.
Yeah.
And let me know if you want me to clarify anything more with that.
Well, I'll see if we have some questions in a minute, but thank you. Good job. It is, it's a big topic to, you did
Mhm.
it in like under 2 minutes, I think, too. So it's
Okay.
pretty amazing. If I could add one thing
Mhm.
too, to clarify some of the confusing headlines that came out of the Women's Health Initiative in 2002 is that the women in the study were on average significantly older than what the researchers originally wanted to study, but
Mhm.
they had difficulty recruiting, hundreds of women who were age 40, 45 and wanted their health to be followed for 30 years. So they ended up with a much smaller cohort of older women. And guess what? Older women are already predisposed. We have a higher propensity of breast cancer incidence and diagnoses and heart disease and stroke. So it was so flawed. Um,
Mhm.
and the communication was so flawed that when the results, the negative results came out, it hit front page news. And when it was discovered that there was all these inaccuracies, it barely made the back page news.
Exactly.
And I think that's just really important because a lot of the things that we do in the Menopause Chicks community is really, to make sure that women know how to absorb the news, find quality information, read down to the 35th paragraph if you have to actually realize, was that headline really telling me what I thought it is? And if you have any questions at all, then have a health team, hormone literate health professionals that you can go to actually clarify your questions.
Absolutely. That's exactly. I'm so glad you brought that up because that is something that study scared a lot of doctors, and a lot of
Yeah.
doctors pulled those women off those hormones. And what we found is when we went and looked back after the years, that their quality of life was worsened and actually have increased risk for other factors. So it wasn't the whole picture, and it really kind of put a negative tone on the whole notion of hormone use. It's not quite fair because what we see with hormone use is it is one of the most effective treatments for hot flashes and insomnia, and anxiety and mood changes. So that's pretty powerful when you consider it all.
It's very powerful. It did do a disservice to so many women. And I'm not sure if you were going to mention this or not, but now we want women to understand this concept of investing in their midlife health, because we are the first generation to turn 50 and have 50 more years to plan for. And taking care of our hormone health now is going to significantly positively impact our brain health and bone health and breast health and heart health down the road.
Exactly. Yep. You said it.
Yeah.
It's so
Okay.
true. It's such an investment in you. And
Cool.
I love using that term because I think that really rings true is you get to look in and you get to fill up your cup first for once
Yeah.
and kind of give yourself that love.
Yeah, for sure, for sure. Okay, we're at the halfway mark already, and I feel
Mhm.
like we've just barely started. So I'm going to take a look at some of the questions that we've got. You have some early questions in front of you. I think the first one was asking if we could speak to vaginal dryness. So could
Mhm.
you dive into that one?
Absolutely. So, this is a really common symptom that a lot of women experience in the postmenopausal phase of life, because, of course, your estrogen levels have decreased, and that estrogen is in charge of that juiciness. So, juicy joints and juicy vaginal secretion. So, a way around this, there's multiple options. So, if we think about simple therapies, using a vitamin E suppository, that actual capsule, you can break it open, and kind of put it around the vaginal area in the opening. You can also use a hyaluronic acid and a vitamin E blend that I believe Menopause Chicks actually has. That one there, yes. So that's a lovely start and can be very effective simply as it is. And then, of course, something like a vaginal estrogen.
Mhm.
So this is usually an estriol or estradiol, and you're using a very small amount that you will use. We don't have to get into the dosing timeframes, but
Right.
generally it helps to replenish the tissue of that area, improve blood flow, which can improve sensation and positive effect on orgasms, as well as start to improve secretion of vaginal lubrication. So really, really beneficial. And that one is often used just long term. We kind of modify the
Mm.
dosing a little bit, but very safe. And as recent studies have shown, there's no really systemic effect, meaning it doesn't go elsewhere in your body when we're using that low of a dose locally in that tissue. So very safe. Mhm.
I, I think that's so good that you underscored that option for women, because even women who have had breast cancer will use localized estrogen therapy to address vaginal dryness.
Yep.
Yeah.
Exactly. Yeah. Very, very safe. And one caveat, though, I should mention is be mindful with your time of application and your time of
Mm.
intercourse.
Okay.
Because, of course, you don't want to be transferring that estrogen to your partner.
Ah,
Yes.
yes.
So, at the bare minimum,
Right.
you're going to wait at least 1 hour after application. It's usually best done right before bed.
Okay.
And then, kind of through the day, it'll take its effect, or through the night, and then you're a safer bet.
Okay, good, good. Okay, Dr. Rochelle, this is going to feel a little bit like a rapid fire.
Sure.
So I'll just start throwing the questions at you, but I do want to just say to our guests who've joined us tonight, if we don't get to your question within the hour, I will make sure that your question does get answered in the Facebook community. So don't worry, we will go through those after. Okay. Shannon has a question about what someone asked, if there is such a thing as a second menopause. Have you ever heard of this? I
So
don't
a
think so.
second menopause, I would presume that that generally kind of marks a second change in hormones, probably
Right.
after they've had that initial anniversary.
Yes.
Now, I believe it is possible to kind of enter into that phase, and that would just, in my mind, kind of require a bit more of evaluation. So, testing, have some blood work done, have some hormones assessed to see, okay, where are we standing? And importantly, it's great to have considered what was your initial baseline in your beginning of menopause. So that's where regular testing can
Yes.
really tell to decide, has that actually happened or have things just shifted?
Okay. Yeah, for
Mhm.
sure. Yeah, and maybe Shannon, you're asking about perimenopause too, because it's very common for some women to, like I mentioned, to go 6, 8, 10 months without a period and then get it again, and that might
Mhm.
feel like it's menopause, but it's not actually.
Yep,
Yeah.
exactly.
Okay. This is another big bucket, Dr. Rochelle. Billy Joe has a question. What is the best thing to do for estrogen dominance?
Great question. So, this is generally happening in the perimenopausal phase. So, symptoms of estrogen dominance, probably experiencing really heavy periods,
Hmm.
fluctuations in mood, irritability. So, what you can do is work on ways to flush out that estrogen from your body. Now, your body naturally wants to do that. Your liver will decide, okay, we've used up enough estrogen. I'm going to be putting it into the stool, and having a proper bowel movement will
Mm,
ensure that you are binding those estrogens and then flushing them out. If
okay.
you're not having a proper bowel movement, something like fiber will be really beneficial to grab onto those estrogens and essentially rid them out of your body. In addition, using something more specific for your liver. So, helping to detox those estrogens. There's a supplement called DIM. Now, it's a long chemical name, but essentially it helps your liver process the estrogens and rid kind of the more detrimental ones that can cause the symptoms or experiences you're having. So, that would be kind of my two go tos. But in addition, take a look at your progesterone.
Yeah.
So we know that your progesterone is in charge of balancing that estrogen. And if that is way down here, we can bring that up. The effects of estrogen will be modified. So, kind of a multifaceted approach. But I hope that makes sense for you guys.
Yeah. It's kind of like balancing the teeter totter,
hmm
which is doable,
It
but
is, yes.
sometimes challenging.
It is. Yes, it is. Exactly. But yeah, looking at all the factors are important too. Stress is one of those as well. So stress
Yeah.
kind of promotes that estrogen dominance, decreases your progesterone. So that's always at that foundation.
Yeah. Okay. Linda has a question about an irregular heartbeat, or what's often coined as heart palpitations.
hmm Okay. Is this just around that itself or?
So she's waking in the night feeling anxious and aware of a irregular heartbeat.
Okay. So right away, I would hope that she's brought this up to her health professional and has had this worked up, whether that is an ECG or further testing. If that is deemed fine, that might be a bit of a progesterone
Yeah.
deficiency. So we know again, progesterone is that calming, that sedative. It really helps your body relax, and an imbalanced estrogen level will kind of allow your body to kind of fly and kind of come out of balance in relationship to that estrogen. So that would come to mind for me. In addition, using natural minerals like magnesium is really
Mhm.
wonderful for your nervous system, beneficial for your heart and your vessels. Really great as an intro option to help us sleep too.
Absolutely. Did you know that heart palpitations was the number 2 conversation in the Menopause Chicks community last year?
Okay. Wow. Okay. That's
Yeah.
fantastic. Yeah.
And it's, we'll spend some more time this year, exploring that and unpacking it, because all I can think about is all of these women are now going for ECGs and like lots of heart specialists, and that's great because we want you to check out like everything that's not making you feel well or is concerning your health. But if there's an opportunity to also, balance our hormones and introduce some more stress management techniques,
Mhm.
that's going to help, I'm hoping.
Absolutely. And one little pearl there too is I find if people tend to wake up frequently through the night and tend to
Yeah.
feel their heart rate is kind of set off, that can be a sign of low blood sugar. So
Oh,
if you are a late night snacker on sweets or treats, things like that, you go to
yeah.
bed, your blood sugar will be high initially, but through the night, it's going to crash. That crash is not a great state for your body to be in. So your adrenal glands release adrenaline and that cortisol because that will naturally bring it up. So you're going to wake up with a beating heart. You might wake up flushed or anxious. So that's something that you can also consider.
Oh, good to know. Thank you for that, Pearl. I love it. Okay, Anna has a question. She wants to know whether women who do not have a thyroid and are on medication, how adrenal issues can impact their health through perimenopause.
Oh, love this question. So,
Really?
what we know with our thyroid to our adrenals to the ovaries is they are all connected. So, that's what we call kind of an axis. So, all those hormones are communicating to each other. And in the naturopathic world, at a foundation, whenever we are addressing your thyroid, always addressing your adrenal glands. You can kind of imagine an imaginary string connecting the two. If your thyroid is under functioning or if your adrenals are under functioning, someone is being tugged and pulled and
Mm,
they're not going to be functioning as optimally. So definitely assessing that wonderfully would be a great approach.
that's a great way of explaining it. I'm stealing that. I'm going to steal that one too.
Go ahead.
Okay, Mary is waking a dozen times per night with hot flashes and night sweats.
Okay. So I would say at that foundational piece, what are her stress levels during the day? What is she doing for herself to assure that, she's easing into a natural rested state to have good sleeps? As well, considering what is alcohol content and
Mm,
consumption, because that can often increase hot flashes and the stress levels combined. But also coming back to that progesterone. So
yeah.
that progesterone is going to be helping balance the estrogens, but also just calming your body and starting with that approach is often helpful. And then if progesterone and even considering magnesium is not quite helpful enough, you could consider a topical estrogen to just help kind of kick off and balance a little bit more in that area. But yeah, that's a common concern.
It's a common concern. And if
Mhm.
I could add something to that, it's that you're not meant to suffer. We want women to understand that you are not meant to go through years of waking up 12 times in the night. It's common, but it's not normal.
Yeah.
And so there's health professionals who, like Dr. Rochelle here, who can really work with you and restore your quality of life.
Oh, exactly. I know. I love hearing that because my mother suffered through and went through
Oh,
her own
really?
journey. And obviously at that time I wasn't quite able to assist with her.
Right.
But yeah, you don't have to suffer. And there are so many ways that you can so easily tweak for relief. So it's about finding a person who can help you through it.
Yeah. Yeah. So don't suck it up. You're
No.
worth quality of life. Okay, back to the hormone therapy conversation for a minute. Jill has a question about how long someone would stay on hormone therapy, and I think that's a common question too.
Absolutely. So generally the recommended time frame is of course within that 10 years of use from menopause to age 60 is kind of the recommended time frame. But really I like to start people on hormones and then we reassess once we've found that they're stable every 6 months to a year. And
Okay.
so at that point, we can decide, do we kind of wean a little bit off the dose? Are you stable? If not, we go back and wait. Now, if we're kind of getting up to that 10-year mark, that's when we have that conversation to say, okay, if we are on something like estrogen, perhaps your risks are increasing a little bit. But if we deem that your quality of life is much more important and you having a good night's sleep is very vital, then we continue on. So it really is individual. about kind of what is managing your symptoms. So there's not kind of a surefire answer there, actually.
No, absolutely. We're all individual, and our hormones are constantly fluctuating. So the protocol has to be matched with what's happening in your body.
Mm-hmm.
I like this next question. This is Mary. I'm not sure if it's the same Mary or different Mary. I don't get hot flashes during the day, but in the evening, I am extremely cold. I am freezing even with the heat on. It's weird, but it happens like clockwork every night.
Okay. So just to clarify, no hot flashes during the day, just being frozen at night.
Yes.
Okay. So being cold, that usually is associated a bit more with thyroid function.
Yes.
So I would consider having that assessed in detail, having your full thyroid panel. That's going to include your thyroid hormones as well as your TSH. Make sure you're asking for all of that to see if that is off, because common symptoms of underfunctioning thyroid are feeling cold, colder than the average person, constipation or hair loss, kind of feeling sluggish at a whole. So that's what comes to mind for me. Something to consider.
Yeah, for sure. The other thing, isn't iron
Yes,
deficiency responsible for some of those things too?
most definitely. Exactly. So absolutely. So iron, of course, is in charge of binding nutrients and oxygen and perfusing our tissues. So if you're feeling really cold, that might be a sign of low iron. And low iron is another common concern into the perimenopausal midlife phase, either with having lots of bleeding prior.
Yeah.
So definitely checking your iron is very important too.
Okay, awesome. And I'll post a link for Ferropro, which is the iron that Bob Mayer, who's the CEO of Pure Pharmacy, who supports the Menopause Chicks community. I'll just post a link for Ferropro because there's a really great chart there, and also just signs for you to watch for, or to even share with your friends and your coworkers about signs of iron deficiency.
Absolutely. And I love Ferropro. I use it a lot myself with my
Okay. Yes, me too. Lucy wants to know if melatonin is safe to use for sleep challenges.
Yes, absolutely. So I know there has been concerns where people don't want to become reliant or addicted on melatonin,
Mm-hmm.
but it doesn't work like that. So you don't have a negative feedback loop when it comes to melatonin, meaning your body can't become dependent or addicted to it. So it is very safe and very effective. And again, we know that melatonin actually improves your progesterone level. So
Oh,
great. Exactly. Yep. It improves your progesterone levels and it sensitizes your body's receptors to progesterone. So it actually is a great tool in the menopausal area time frame.
awesome.
Mhm.
Awesome. Can I just say you are excellent at this rapid fire Q&A? If we were in a room right now, we'd all be giving you a big round of applause.
Thank you. I'm so happy to be going through it. It's great. All
We've
good
got about 12 more minutes. I have no idea how many more questions are here, but let's keep going. Leanna says, this is a big one. My doctor is not menopause literate. How do I get her to test my hormones?
Okay. So I would say this is a common thing. And unfortunately, I see it a lot where women come in and they feel really unheard, or they're told, well, that's just the way things are.
Right.
So I find you have to kind of tread cautiously because you don't want to make your doctor feel kind of inept or ill-informed to the subject. So you can kind of bring information in to say, well, I've heard this is connected to this. Could we test my hormones? So kind of offering it as a question and a consideration can be helpful.
Yes.
That's a starting place. Or more importantly, find a doctor who is hormone literate. So doing your research, checking in and seeing, are they trained in more detail, or asking your friends or colleagues to see who they've worked with before too. So that might just be an easier option for you.
Yeah, that's great advice. And in case you don't know this is something, I didn't realize this 10 years ago, but it's okay. Keep your family doctor. You need a family doctor, and add another hormone literate or menopause literate health professional to your health team. And in a perfect world, they will talk to one another because they're both, or, two or more, they're all concerned about you and your health and your quality of life.
Absolutely, exactly. Let's be a team and support
Yeah.
you in every way. Absolutely.
Love it. Okay, Jenny, Jenny's period stopped 5 months ago, and she wants to know, what does the FSH test reveal?
Good question. So stands for follicle stimulating hormone. It comes from your pituitary, which is located in your brain,
Mhm.
and it is in charge of signaling to your ovaries to produce your hormones. So it's a common marker to designate when you fully have entered into menopause because it will be elevated, meaning that your brain is trying to get your ovaries to function. But as we know in menopause, they're starting to hibernate and starting to kind of shut down. So there is no response there. So your brain keeps trying to send that signal. So it's just a marker to see where you are in the perimenopause or menopausal phase.
Great, 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 great. Thank you. Julian is currently on bioidentical hormones, progesterone and estrogen,
Mhm.
but she hits a wall every day around noon and is experiencing huge fatigue.
Okay, so that's great that she's supported with those bioidentical hormones. I would consider addressing her adrenal glands. So, again, your production of cortisol is important for your energy throughout the day. Again, we start with a high amount of energy and then it continues through the day and it will dip in the evening. That's the ideal time frame. And that
Mhm.
is largely in charge for that energy. So, if you're finding that afternoon dip, I would suspect that your adrenal function might be a little bit lower than optimal. And I should say that I see that all the time. And in fact, in my clinic, in our first initial visit, we do a comprehensive assessment looking at your adrenal function. And I would say 8 to 9 times out of 10 in women in this phase of life, their adrenal function is suffering. And so we know that your hormones aren't going to work as effectively if that uh, a part of your body and system is not optimal. So I would look
Right.
into some adrenal support.
Yeah, yeah, yeah. And I'm not sure if it's the case with Julianne, but I just would like to add to those of you who are listening and maybe considering having a conversation with your healthcare provider about hormone therapy. It's not a one and done scenario. It's not a, oh, I did this and now I'm good for 5 years, because as I mentioned, your hormones are constantly fluctuating, and it's really important that you go back, if your healthcare professional is not requesting that follow-up appointment, that you go back and request it, because you may require tweaks along the way.
Absolutely. Yes, absolutely. That is something. If you are feeling you're stable on hormones that you are, and then you are noticing that shift or change, definitely go back and see and just have a visit. So that's what I encourage with all of my patients is come back if anything changes, anything is feeling off, and we'll readjust because you should feel fully supported in that experience.
Great. Okay, Leanna wants to know, are there any studies on the benefits of cannabis?
Yes. So cannabis in itself, now I should say, as a naturopathic doctor, my legislation with my college, we're still working around
Okay,
the way and the means that I can actually have an open conversation. So
got it.
I'm actually a bit restricted in talking about this in too much detail.
Okay.
But there are studies out there that you can seek that will give you more information to see the benefits, as well as things to consider if you were to use it. So I would recommend finding a doctor who is literate in cannabis use.
Okay. All
Mhm.
right. And thank you. And it's very confusing, right? Because now, as soon as it became legal in Canada, it's almost like we've restricted those people that know from talking about it.
Yes.
That's crazy. Okay. Let's see, where are we going to go next? Here's a question. Someone's mentioning birth control pill, and I want to. It's a long question, but I'm just wondering if you want to comment on the birth control pill. Not always do members in our community realize that the birth control pill is a form of hormone therapy, and it's often prescribed by family physicians as a strategy. I don't know what you think about that.
Oh, yes. So yeah, it definitely is. So this is often used often in the perimenopausal phase.
Yes.
If there is excessive bleeding, if there is severe symptoms or experiences with mood changes. So again, those synthetic hormones, because that's what birth control is, it's synthetic hormones, will be essentially kind of hushing your own production. So it'll kind of just take over and nudge out any imbalance. Now, it's a bit of a band-aid effect. So it may help you get through that trial, but you will want to consider coming off of those in the future. And if you haven't really addressed the underlying concern there, you might actually rebound back to where you were. So I think addressing that from a different approach might be something to consider as well.
Yeah. And women will bring up the similar question around the Mirena Iud.
Exactly. Yeah, exactly. So that is a synthetic progestin. So it acts like progesterone, more or less local in the uterus area. So that will help reduce heavy menstruation and bleeding. So that's the primary use with that one.
Yeah. Let's swing back to one of the questions that was asked, because I think these two connect. We had Michelle, who was asking a question about heavy bleeding, about flooding,
Mhm.
and wanting to know what her options are.
Okay, so again, heavy bleeding is a common experience that women see in the perimenopausal phase when we're having that peak of estrogen or the fluctuation without it being checked by a good balance of progesterone. So, what we think about what determines flooding or heavy periods is generally beyond 80 mils in a cycle. So, if you use a
Okay.
Diva cup, which is a wonderful way to track your fluid amounts, or at 16 regular tampons. So if you're going through
Mm.
that much in 7 days, that would constitute flooding, as well as if you're feeling exceptionally tired and dizzy and fatigued in that time frame, you're knowing you're losing a lot of blood.
Yeah.
So definitely something that would be worthwhile discussing with your doctor and seeing if you can use therapies to reduce that effect.
Yeah. And I think, the most confusing or even concerning um, thought for women when they're in that state is this a one-off, or
Mhm.
is this the rest of my life? Am I going to go through this for the next 3 years? And they're just, kind of confused as to what their best options are.
Absolutely, yes. And there are many different approaches that we can take. So we can consider our herbal approach. So
Mm.
natural herbal therapies to bring up your or your progesterone to again balance that effect. We can also use herbal tinctures that can act as an astringent and it can reduce the flow. So that has been something that I've used with patients for those random occasions. So we might send her home with this tincture to say, okay, if this is happening, you can use it every couple of hours and it will reduce it if you need it versus kind of shifting hormones in more direct fashion. So that's a strategy.
Love it.
Mhm.
Love it. Thank you. Okay, we're so close to the end of our time together. I can't believe it. Do you have time for two more questions?
Absolutely. I have more time. No problem.
Okay, thank you. We had a couple women post about vaginal dryness, which we addressed, but I have one here is also concerned with bladder leakage.
Mhm.
It's another very, very common concern that women may think they have to put up with. So, what's our message for them?
Yes, so that is a really common concern in usually the menopausal years when you have that reduction of estrogen. Estrogen helps to tonify the bladder muscle that kind of holds it closed, as well as the cells in that area too. So that is a common experience in itself. What we know though, when we're using estrogen therapies, is that oral doses can actually increase incontinence or bladder
Mm,
leakage. So, considering with working with a pelvic floor physiotherapist,
yeah.
kind of improve the tone can be really beneficial. Something like the Kegel exercises too. So,
Yeah.
mhm.
Everybody make an appointment for a pelvic floor physio this
Yes,
year,
yeah,
right after you make your naturopath appointment.
yeah.
Okay, this is a big one for the last one, I gotta say, but it's a question from Donna about your recommendations for supplements, vitamins and supplements.
Okay, so just in general, um,
I think specifically she's asking for anxiety and insomnia. I see that now. But you know, it can be overwhelming for a busy woman in midlife to kind of make that first trip down the vitamin aisle and not really knowing what to look for. So
Absolutely. And I can relate. You walk into a health store or any place and it's a wall of
yeah,
options. So I get it. So I think it's a great idea to talk with someone who is, say, supplement literate, to choose the best forms and brands. Now, not all supplements are created equal. There are
yes,
different types of the, say, for example, magnesium is a
yes,
wonderful supplement for everyone, but in particular, menopausal women in this age,
yes,
because again, we talked about it, it calms your body, it relaxes, improves sleep. But there are types that are better than the other. There are types of magnesium that are laxatives, great for that purpose, and some that are better for sleep. So having that conversation and making sure you trust someone to give you more specific advice is a good idea. And then other supplements to consider, something like a B complex is really beneficial. So that's really great for also balancing hormones. B6 is really great. That will help kind of reduce extra estrogen, but also improve mood. It helps increase serotonin, which is great for memory and contentment, as well as overall energy. So that's a really great one. And then, of course, something even more supportive relationship to vitamin C is a really easy one. That's really helpful for hormone balance and production in itself. Um, or iron again. If you've
yes.
determined through testing that you need it, that would be a good option. Um, but it really is a multifaceted question because it's really going to be optimized to you and your levels. So chatting with your healthcare professional to determine really what you need, and you can curate that plan a bit more.
Yeah, for sure. And, you know, whether you know, believe you eat healthy, you want to get as, you know, as many vitamins and minerals and stuff from your diet, there comes a time that if your body is tapping you on the shoulder and saying, hey, I need some attention right now, it might just be that your diet is the first place you want to look at with your health team.
Absolutely. That's something that's so modifiable and so easy to tweak.
Mm.
Even something like caffeine. Now, caffeine is
What?
yeah, caffeine is the world's most common drug. It's so ubiquitous that we forget that it has actually a very large effect on our bodies. So for many women with hot flashes and insomnia, cutting out that caffeine, switching to a herbal tea or decaf is game changing for them. So that's a really simple technique, as well as modifying your alcohol intake.
Oh, I knew you were going to say wine next.
Yep, something to consider. So those are small tweaks you can even just experiment with on your own before you see a healthcare professional.
Excellent, excellent.
Mm.
Okay. Wow. Thank you, those of you that are watching and joining us tonight, for your amazing questions. I know we didn't get to all of them, but we will in the next few days or week or so. So, really great to have this conversation. Really grateful to you, Dr. Rochelle, for taking time out of your day to join us for the truth about perimenopause and menopause. I've loved this, and I hope that maybe you'll come back and do it with us again one
Oh,
night.
absolutely. I would love to. It's been so great. And honestly, I love kind of empowering and connecting with other women and making them feel like, okay, I've got this. I understand what I'm doing here. So it's a treat for me and honestly an honor to be amongst you beautiful women too.
And it's empowering to know that there are health professionals like you out there who are so passionate about
Yeah.
supporting women in midlife and you know, just really helping us decipher all of the confusing and conflicting information.
Absolutely. Yeah. Having the more knowledge is a better approach to it too. And I definitely encourage that.
Thank you. We're getting lots of thank yous in the feed too, so I'll
Thank
pass those
you.
on to you. Is there one thing that you would like to leave us with tonight? If we only remember one thing, what is it that you'd like us to know?
Um, don't give up. Don't settle for anything less. If something feels off to you or you're not feeling right, but your concerns have been dismissed, move on to someone else. and address them. You do not have to suffer, and you don't have to think like maybe it's just in my head. It's not, and you don't deserve to question
That's so beautiful.
that.
Thank you very much.
You're welcome.
Okay, thanks everybody. We'll post this in the unit section tomorrow. Thanks for taking the time, and thank you for putting your own name at the top of your to-do list.
Great. Bye, everyone.
Bye.